Good morning and welcome to Global Healthcast, brought to you by Global Health Press. In this podcast series, we bring to you once a week news and views about infectious diseases, vaccines, and vaccination. I am Joe Schmitt, and with me, as always, is Dr. Melvin Sanicas. Good morning, Melvin. Good morning to Switzerland.
Good morning, Professor Schmidt, and good morning to our listeners or watchers. Good afternoon or good evening, depending on where you are at the moment.
Today, we have plenty of very good news for you. We will report about a drug with 100% efficacy against HIV infection in young African women. We will bring to you new treatments for individual treatments for colon cancer. We will report about dengue that is increasing in many countries. I will speak about yellow fever vaccine, and dilution of the vaccine doesn't reduce immunogenicity. I will report about COVID-revaccination and hypersensitivity, and about peptic ulcer disease. And finally, the announcement is the 7th edition of the TBE book is now published. And you'll find the link here down on this slide. Having said this, let's get started. Melvin, what is the news about this new anti-HIV drug? It sounds very exciting.
Yes, this was covered in the news a few days ago, more than a week. A new antiviral drug provided young women in Africa with total protection from HIV, and it's 100% efficacy, according to interim results of a large new clinical trial. And this drug, Lenacapavir, is a twice-yearly injection made by Gilead Sciences. They conducted a study in Uganda and South Africa, and they tested how Lenacapavir's protection was compared with that of two daily pills, Truvada and Descovy. So basically, it's a comparison of an injection given twice a year and a daily pill. And in this study, none of the over 2,000 women who received lenacapavir contracted HIV. So I think this is really good news, even though this is just an interim result. This is just something that's potentially game-changing because it's only given twice a year. It's of course convenient, and hopefully this is something that can be accessible to many people.
Excellent. Look, I have to take my high blood pressure medication every morning, and there are mornings when I don't remember if I took the pill or not, right? So there's always a chance you forget the pill, but you will not forget your twice a year appointment for a drug to prevent HIV infection, right? If you forget the appointment, they will call you, or there is a hiccup in the system, right? I think this is very exciting. And I mean, it's not a double-blind placebo-controlled study, but 0 cases in 2,000 subjects with a 2-year follow-up is really exciting. This is excellent news. Thanks for picking this up from the New York Times. You have another exciting story, Melvin, and that is on colon cancer.
Yes, so an analysis of data from a randomized clinical trial for patients with stage 3 colon cancer found that those with a specific mutation, it's called the PIK3CA mutation, those people who took celecoxib, an anti-inflammatory drug that's commonly used, after surgery, they lived significantly longer and had longer disease-free survival compared to those who did not take the drug, of course, and did not have the mutation. So the study highlighting a potential breakthrough in personalized cancer treatment was led by clinical investigators at the Dana-Farber Cancer Institute and the Brigham and Women's Hospital in Boston. And these findings are the first clinical trial results to actually validate previous observations that adjuvant anti-inflammatory prostaglandin inhibitors, such as celecoxib, improve survival for PIK3CA mutation in colon cancer.
I don't know anything about this mutation and the details of the pathogenesis of colon cancer and inflammation, but we had in one of our previous series, we discussed infectious diseases and cancer, and very often it is chronic infection that results in cancer. And I'm not sure if this has something to do with it, but it is very interesting that an anti-inflammatory drug reduces cancer progression. Very interesting.
Yep.
Maybe we get more about that in a later podcast.
Mm-hmm.
Melvin, one piece of bad news that comes from you today, and tell us about the finding.
So this is actually a map prepared by the US CDC, and you will see here the different countries reporting higher than usual number of dengue cases. So as we know, dengue is a year-round risk in many parts of the world, with outbreaks commonly occurring every 2 or 3, 4, or even 5 years. Some countries are reporting increased number of cases of the disease, and these are countries listed here. Dengue is spread by mosquito bites, as you know, now, because we've mentioned it several times in Global Healthcast. And of course, travelers to risk areas should prevent mosquito bites by using insect repellent, wearing long sleeve shirts and long pants when outdoors, and sleeping in an air conditioned room or room with window screens. And of course, we now know that there are vaccines available depending on the country where you're in. So we have Dengvaxia and Qdenga. These are the two dengue vaccines that have been approved in most countries now, actually.
Interesting. So why would we see this increase? Is it just fluctuation over time, or do you see any link to any specific cause?
Well, one thing that's been mentioned regularly by experts in dengue is, of course, the fact that the mosquitoes who can transmit dengue, they are now able to live in more countries because of climate change, because of global warming, and where there are mosquitoes that can transmit dengue, and the people are now traveling again after COVID. So it's really just not unexpected for this to happen. And I think that's the reason why a few weeks back in the news, people are saying that for the Olympics, which will be in next month,
Paris.
right? Yeah,
Paris, yeah.
in Paris in the next month, people are concerned that dengue could be one of the problems there as well.
Imported dengue. Look, Paris is not on the list here, and I wouldn't expect to see dengue, but I would expect to see imported dengue, wouldn't you?
Imported dengue, yes, and the mosquito that can transmit dengue, they are found in the south of France.
Okay. Interesting. Yeah. Interesting finding, a little bit scaring, but we will follow up on this one. I have 3 items, and the main purpose of showing you my 3 items is that you read the paper. Wonderful papers, and this one is on a live vaccine, on the live yellow fever vaccine. And what you see here in this curve, this is a reverse cumulative distribution antibody titers, neutralizing antibodies, 10 years after the full dose or reduced doses of the dengue virus vaccine. And in red, you see the full dose, which is 27,476 units. And then here you see the dilutions up to 31 units. And this is almost diluted 1 to 300, right? I mean, you take the 300th part of the vaccine and it is still working. This is unbelievable. What you see here, these curves are indistinguishable. And from an immunogenicity point of view, they are all very, very similar. They're overlapping. So if you give the full dose or the very much diluted dose, you get the same neutralizing antibody response. There's a little bit more here on the details of the study. Important to know, the usual volume was used. The reduced doses were produced by dilution in the laboratory of the manufacturer. They did this very carefully under the good manufacturing procedures to make sure that you can use this, and there was ethical approval and all of that. So this was a new drug. If you change the vaccine, you have a new drug, and you need to be allowed to do it, and you have to follow local laws and regulations. So don't ever try to use a yellow fever vaccine by reducing the dose or by diluting yourself. This would be illegal in probably any country of the world. It is just very important, and I think it's a very nice finding. It is a live vaccine, and apparently a very low amount of viruses is sufficient to replicate in the body and to induce a neutralizing immune response. What they did not measure is any other type. They may have done it and I may have overlooked it. Neutralizing antibody is not all that you're looking after in an immune response. There are T cells, there are memory cells, there are regulatory cells, there are all types of other immune elements that you would have to that you would have to evaluate to say that there is equal protection. So we don't know if the equal neutralizing antibody titers are correlating or indicative of a equal efficacy. So I would highly recommend to not dilute your vaccine doses, right? It may be dangerous. And we have to wait for further study results. But again, it is very interesting from a principle point of view. Melvin, any views from your side?
Well, I think it's not surprising, right? Because it's a live attenuated vaccine. And so we know already from theory that basically normally you just need one dose for that, as opposed to other types of vaccines. But it's good news.
Yeah. But I frequently receive the questions saying that manufacturers always start with a high dose and then with time they reduce doses, the number of doses, and maybe even the antigen content. But again, the story is if you develop a new product, you don't want to spend your 1 billion investment with a vaccine that will fail. So you usually try to get a very high dose and many dosing schedules before you ask for a license to be on the safe side. You don't want to miss your efficacy endpoints because you use not enough doses or not enough antigen. So this is and later on you may be able to reduce, but only later on, right? Yeah, I think this is interesting. I have another story that is COVID revaccination after hypersensitivity reaction. And hypersensitivity reaction encompasses anaphylactic shock, and it is also non-anaphylactic shock type hypersensitivity. And finally, it may be other types of hypersensitivity, late hypersensitivity. So what they did is here, they evaluated patients with hypersensitivity reactions after COVID vaccinations, and they sent them to a specialist, allergist, immunologist. And after evaluation, they were vaccinated. And what you see here, 92% of 100 referred to hypersensitivity reactions were recommended for revaccination. And a small portion was only where the specialist said there may be a danger, right? If you administer the vaccine again, there may be anaphylactic shock. 85% with physician-diagnosed hypersensitivity had no recurrent symptoms after revaccination. So it may be safe to revaccinate after a hypersensitivity reaction after COVID vaccine administration. That is good news for all of those who are at high risk for COVID. The recommendation is see an allergist, immunologist, and ask him if you really have anaphylactic shock and if it is safe to give you another dose. Very likely you can be safely vaccinated with another vaccine dose. Melvin, any comments?
Well, in the beginning of the pandemic, this was one of the issues, right, where people were saying that they should not be getting the vaccine or they cannot be getting the vaccine because of hypersensitivity. Yeah. And I think during that time, of course, the benefit risk ratio was also different as compared to now, 4 years after the pandemic, right? But this is just good information for us to be able to give better advice to people.
Yeah. So I think this is good news. It probably applies to other vaccines as well. There is no data, or at least I'm not aware of data, but overall, this is very good news. And I think if you're out there in private practice, you don't want to see an anaphylactic shock, so you don't vaccinate. But the individual may want to be vaccinated, and if he is at high risk, he would benefit from it. And now we have the procedure. Send the patient to an allergist, immunologist, and ask him, can I revaccinate? This is what people should be doing, right? I have one other nice piece. I have one other very nice publication from the Lancet, and I like it because this explains peptic ulcer disease. And when I studied medicine decades ago, peptic ulcer disease was the classical disease for psychotherapy. People did not know about Helicobacter and all of that. And this was all wrong, right? I mean, psychotherapy may be beneficial, but it will not cure the peptic ulcer. And here is the story. We know now Helicobacter pylori is increasing gastric acid by inflammatory reaction, by pepsin induction. And the Zollinger-Ellison syndrome is a disease that has been known for a long time, where a hormone is produced that in the end results in the production or induces the production of more gastric acidity. The same is true increased age, non-steroidal anti-inflammatory drugs like aspirin, alcohol, delayed gastric emptying, smoking, critical illness, and all what is listed here. They all have a higher risk for more gastric acidity, and that induces peptic ulcers. And it's a very nice review article. I can highly recommend it. I like the disease because I was really perplexed when they discovered H. pylori in Australia. It was an Australian team, and they came up with a pathogenesis. And today you use antibiotics to treat H. pylori-induced peptic ulcer. And with that, you can even treat or prevent gastric cancers. So this is really a very nice review article, highly recommended. And for me, it is just decades after studying medicine. It shows you how far advanced, how far we came over the last decades. Melvin, any thoughts?
This is very interesting because, like what you said, our understanding of peptic ulcer disease has changed over the decades, 2-3 decades probably. And now we are seeing this in other diseases as well, that our understanding has really changed in the last few decades. For example, HPV and cervical cancer.
Yeah.
Before HPV was discovered as something that can cause cancer, nobody really thought that it was something that could be preventable with a vaccine, right? So yeah, it's very interesting.
Yeah. With that, I have a piece of advertising, and the advertising is for Vaccelerate. Vaccelerate is a European Union funded academic enterprise throughout European institutions, and they have a volunteer registry if you want to participate in a study. And they had a balloon flying over Cologne. So if you live in Cologne, you may have seen the balloon, and it says, yes, I want to register. The Accelerate registry, vrec.eu, and there you can register to become a volunteer in a future vaccine study or other study in case of a pandemic. And that certainly would help researchers to come up with better vaccines, better treatments, better knowledge on not only COVID, but future pandemic organisms. And you'll find more on the details of that here under Accelerate. You find more about the balloon flying over Cologne. It was a Zeppelin really flying over a balloon, advertising to become a volunteer in a clinical study setup. I think this is exciting. Congratulations to my friend Oliver Corneli, who runs the show here and who organized that, and his team. I think this is a wonderful idea. Melvin?
Yes, I did not know that Zeppelins still fly over Germany.
Yeah, I guess you can rent them, right? You can rent the space for advertising, and then they fly, and then you can, if you have nice weather, it is helpful. If it is raining, it doesn't help you, right? But I thought this is a great idea, and I'm very happy they're doing this. Academia going out to the public. I just love this idea. And here you find the link to X, former Twitter, if you want to know more about it. And that brings us to the end. We covered prevention of HIV infection with a new drug, twice a year, intramuscular injection, and that is it. Anti-inflammatory effects of anti-inflammatory or of inflammation inhibitor for colon cancer. We reported on increasing dengue in many countries. Reduced doses of yellow fever vaccine. Don't do it, but read the article. It's interesting. I spoke about COVID revaccination despite allergic or presumed allergic reactions. We spoke about peptic ulcer disease and a nice review article. And finally, another piece of advertising, the 7th edition of the TBE book, Frühsommer Meningoencephalitis in German. The TBE book is out, and if you want to read it, it is free of charge. The link is down here. You can download the whole book. And again, it has been out as of June 28th. And the book is really exciting. We have had 2 million readers around the globe in the last 2 years. And our newsletter was read by 20,000 readers in 1 month in the United States alone. A very successful book. And we encourage everybody to download the book or to read it. You don't need to download it. It's a lot of space on your computer. It is available at any time, and you'll find the link here. Melvin, any last comments?
Well, congratulations on this TBE book. And I think it's really an achievement to have those numbers when we are now in the world where everyone is just fighting for attention and likes and clicks. So yeah. I think that's a very good achievement.
Yeah, thank you very much, Melvin. And you have a last word with the cartoon.
Yes, I just thought this was funny. If anyone out there still remembers Pac-Man, this is an old game, but you know, I think the young ones know this from the refurbished version in different PlayStations or different gadgets where you can play. But this is just interesting because for Pac-Man, you have these 3 different ghosts or whatever you call them who are running after you. But once you eat purpose, for example, you will be able to fight these different things like procrastination, perfectionism, and imposter syndrome. And for those who don't know what they are, basically procrastination, of course, it's the act of delaying or postponing tasks or decisions in life, right? And the other one, imposter syndrome, is the experience of believing that you're not good enough, you're not as competent as others. And of course, perfectionism is you want everything to be perfect. But once you have found your purpose, they will all be gone, or you will be able to fight them.
Yeah, I like this. It should be part of management education. If you want to become a good manager, that is something you have to know about, right? I like it. With that, thank you very much, Melvin. Thank you, everybody, for listening. Hope to see you again next week.
Thank you, everyone. Stay safe.